The principle is to be fruitful and multiply. To become pregnant and have children and care for them is very valued. In a discussion of Jewish law and infertility, it is important to recognize that if the practitioner understands the rules, what is appropriate and what is not appropriate, it's not even necessary to be Jewish to take care of patients. The likelihood is the Jewish physicians would be a little more sensitive to some of the issues. The laws are not uniform in that they come from an organized source that's the source for all Jewish individuals. There are not very many rules in Reform Judaism, and as one becomes more conservative or orthodox, one has more rules, including the rules of keeping kosher, the rules of respecting the Sabbath and respecting certain holidays, so that one must plan events around them. If one believes as part of their Judaism that it is inappropriate to travel on the Sabbath, one needs to just design therapies to avoid coming in on the Sabbath. There is no one source that gives all the rules, but there are books that advise. Each rabbi can make decisions for the individual in their congregation. And many Orthodox individuals will consult the rabbi before going through any therapy or following any physician's suggestions. By way of example, some rabbis believe, and it is part of the rule, not to spill one's seed. So one should not have sex unless there's the possibility of pregnancy. Masturbating in a cup would therefore be inappropriate as a way to provide sperm for a sperm analysis. However, one can use a special, safe condom with a pinhole in it so that you will be able to collect most of the semen and yet no rules are broken. There are usually ways to deal with almost any rule and still keep the process kosher.